So welcome or welcome back to my channel. If you're new here, hi, my name is Anushka. I also go by Eternal Honesty on this channel. Either one works. But today I want to do something a bit different than what I normally do. And it's going to be a pharmacology review. Like, I'm just going to be going through some of my med cards that I have and talking about these particular meds, when you would use them, what you would use them for, the drug class, all that fun stuff. Reason why is, like, I know pharmacology is one of the harder class and it's just a lot of memorization in nursing school. And I did get an A for Pathoform 1 and 2, and that's I attribute to my med cards, guys. So if you're someone like you're struggling in pharmacology, I 100% that you come on. I'm gonna try and do these like a few times because I do have a lot of med cards and it's a lot of meds that you need to know. And these are not every single meds that under the sun. So if you're interested, you're a nursing student, you're just in some sort of healthcare like field and you need to know your meds, this will 100% help. So make sure you share this with a friend, a classmate, whoever you think might need it. So I'm just going to jump right into it. I have like a lot. I'm going to try and see if I have a particular like, group of meds I want to like maybe go over. I have a bunch of psych meds right here. I see some anti like platelets, anticoagulants. So let's go with more like the anticoagulants and antiplatelets. So like the hematology meds first. Just gonna grab a few. Hold up. I'm gonna like pause for a second. Oh my gosh, I have a bunch. Okay, that's about it. I'm gonna pause. I'll be back. Okay. Hi. Hi, Adeline. Hi. So, sorry, I had to like answer my doorbell. But like I said, I'm going to start off with doing some of these meds that have to do with hematology. The first is alteplase. So, let me see if I can. The light is so bright. So the first one is alteplase. Again, this is going to be a pharmacology review. If you're a nursing student or in any healthcare related fields, like I'm just going to go through some of the meds that I needed to know and how I studied for them. So if you're a nursing student, you're in nursing school, you're going to start nursing school, you know someone who's in med school or any healthcare field, this will be really good. I am good. So like I say, the first one is alteplase. Anything that ends in like plate, that ace is typically like a thrombolytic. So this is a thrombolytic. The way I remember them is they're clot busters. They're breaking up the clots. So for a thrombolytic to be used, hi there, interstate money. Hi. Their clot has to already be there. So it's not an anticoagulant. Please do not confuse your thrombolytics with anticoagulants. A lot of people do that, but they're used for two different things. Anticoagulants are before a clot actually forms. Thrombolytics, my clot busters, like the name says, they're for breaking up clots once they're already there. So the way that you would use this is the route is IV, so intravenous. You're going to give it through that IV. It works directly on the clots to dissolve them once they have been formed. So like in the case someone has a clot in the brain or a pulmonary embolism, this is the type of medication you would give because that clot has already formed and you want to dissolve it. Considerations bleeding, right? If someone has any like bleeding disorders, or if they have a hemorrhagic stroke where there's bleeding on the brain, you cannot give this medication. So, cannot give it. Yep. And so it's used for, like I said, for ischemic strokes, not hemorrhagic strokes. It can be used for pulmonary embolisms. It can be used for um, myocardial infarctions as well. The key thing to note with this is the onset, because you need to use it within a certain time period. I believe it's 3 to 4.5 hours is like onset. You have to use it, right? But that is going to be your alteplase. Moving on, what's the next one I got? I have aspirin, which aspirin is our next one, which a lot of people know aspirin, but aspirin has a lot of use. The drug class is that it's an antiplatelet. When you're using it for bleeding disorders, it's an antiplatelet. So it's preventing those platelets from clotting together to form a blood clot, right? It can be used in many different routes. So you can do it orally, rectally, or it can be given IV, right? So that's when you're going to use it. And one thing is, we almost never give aspirin to children because it can cause Reye's disease. So be mindful. Like, there's only one case that you would give aspirin to children, and that's with Kawasaki disease. So that is the only exception to, like, we're not giving aspirin to kids except if they have Kawasaki. That's why you never really pick absolute, where like you never give aspirin to kids. There is that one exception, and with medicine and nursing, there's always an exception to a rule. But that's aspirin. I think aspirin is one of those pretty straightforward ones. It can also be used as a pain reliever, right? But yeah. So now we have heparin, and there's two types of heparin. So there's low molecular weight heparin, and then there's regular heparin. This one is referring to the regular heparin. So regular heparin, it's going to be given IV. It's very rapid in its onset, and the way it works is going to enhance antithrombin, so it's going to prevent blood clots. Um, it does have some contraindications. When would you not use heparin? When the patient has thrombocytopenia, you're not going to use heparin. When they have low platelets, you do not use heparin, because heparin can cause heparin induced thrombocytopenia. So you don't want to use it if the person already has very low platelets. You don't want to use it if someone already has uncontrollable bleeding, because again, this is preventing you from clotting. So if you're bleeding out, we don't want to prevent you from clotting, because that clot is going to stop the bleeding. So if someone has uncontrollable bleeding, you would not use heparin. Um, you don't do it before or after surgery, and more so surgery where there's a risk of a lot of blood loss. So it can be eye surgery, brain surgery, and spinal surgery. You would not use heparin right before or after it. And the good thing about heparin, it does have a short half time, so you can stop it pretty immediately, like surgery, like the day of, and your levels will go back to normal. There is an antidote for heparin. It is protamine sulfate. You guys should definitely know that. The amount of time I've seen that being asked, I remember when I was taking pharmacology, that question was definitely asked, like, what is the antidote for heparin? And it is protamine sulfate. You should know that it does have an antidote. Consideration is monitoring that APTT, so that activated partial thromboplasmin time. So that is the level you're going to be monitoring, the parameter for the use of heparin. You want to hold if the platelet counts drop dramatically, because again, it can cause that heparin-induced thrombocytopenia. Thrombocytopenia is just a fancy word of saying you have really low platelet counts, and honestly, it's just below the normal because, yeah. So that's that one. Oh, I do have some more on blood, like, but these are like very specific ones that my professor had went over. Like your professor might go over like different ones, but I'm gonna try and do the ones that like I feel like I've seen on other when I'm looking at NCLEX style questions just online, like outside of my professor. Like warfarin is another one I would say is commonly asked about, like warfarin. So warfarin is another anticoagulant, so it's preventing the blood from clotting. Um, it is more of a delayed onset compared to heparin, where I said heparin was rapid onset. It does take a while before, like, you really see that therapeutic effect of warfarin. It's a vitamin K antagonist, so it blocks the synthesis of certain clotting factors, which are 7, 9, and 10. You probably don't really need to know that. I just have it on the card because in nursing school, they ask you very specific questions. I think for like standardized testing, they're not going to get that nitty gritty. Hi there. If you are on, please make sure that you are liking and you are subscribing to the channel. And make sure that you share this with someone that you think might find this video helpful. Right now, I'm going over warfarin. So, ooh, backtrack. Again, warfarin also does have an antidote. The antidote for warfarin is vitamin K or fresh frozen plasma. That's what we're going to do. Hi, hello. Nursing consideration, you're going to be monitoring the PT and the INR for warfarin. So those levels you want to monitor and make sure is within normal limits. If it's too high, that's not good. And if it's too low, that's not good either. You want it within that therapeutic range. This is also going to vary based on the school where you're at. So like I will say whatever the range your professor tell you to know, but so I don't want to give you guys a set range for that really. And warfarin, unlike heparin, is not going to be used in emergencies. And it has a lot of drug to drug interaction. Warfarin and a lot of drug are not going to go together. So if you ever see a question that's like, oh, what drug, like you have this drug, what drug would you be concerned if if you see the prescriber order? And if warfarin is an option, it's probably, oh, not the phone dropping. That's crazy. But, oh, let me try and mount this back because I don't even know how that happened. Oh. But yeah, so if you ever see, if it's asking a question, what drug to not use with another drug, warfarin, if you see warfarin as an option, it's probably warfarin because warfarin has a lot of drug to drug interaction. Make sure this is on. It's going to stay on because that was annoying. I'm not even gonna try and pronounce this, so but it's clopidogrel. Let me show you guys. So this is another antiplatelet. It works in a very particular way. You don't need to know that. But it's just, again, like aspirin, it's going to prevent those platelets from sticking together and forming a clot. So that's the main thing for this. And the other thing, one of the side effects, it can cause pancytopenia. So it's just all of your red blood cells, white blood cells, your platelets, they're all going to be very, very low. That's what that means. And you want to just be keeping mindful of your CBC. So again, you want to be monitoring your um, red blood cell counts, your white blood cell counts, your platelet counts when you're on this drug because it can cause all of those levels to drop considerably. And I feel like a lot of times when I see this drug being mentioned, it's with like AFib or if someone has a bleeding disorder or it's like those type of questions you're going to see this because they can be prescribed this medication if they have AFib because AFib can cause clots. So you want to prevent those. Okay. So those are some of the big ones that I would say I think you guys should know. Then we also have low molecular weight heparin. So the difference with this and regular heparin, low molecular weight heparin is going to be given subcutaneously. Regular heparin is given IV only, only IV. Low molecular weight heparin is given subcutaneously. You have to know the difference. They will trick you. They will ask a question on this. I promise you guys. They will say, which heparin can you give subcutaneously? Or the person is getting heparin and it's being given via the subcutaneous route. Which type of heparin is it, right? And you need to know that it's a low molecular weight heparin, guys. I promise you, you need to know that. And the way I remember it too is like it's low, and I'm thinking since it's low, it's going underneath, right? Under the skin, like because subcutaneous is under the skin, it's going into that fascia, that fat, versus regular heparin is just going to go IV. So yeah. Hello, hello. All right, let's do some meds for your heart. All right, so the first one up is nitroprusside, which this one is a selective vasodilator. Um, it works by dilating the arterioles and the veins. It is one of the fastest active antihypertensive agents. It's given via IV infusions. You're going to use this for hypertension because it's going to dilate those blood vessels, and because the blood vessels have been dilated, you're going to have like the blood flowing a lot more easily, so it's not pushing against the wall of that blood vessels, causing higher pressure, right? So that's why this medication is an antihypertensive. It's going to cause your blood pressure to drop, and your blood pressure will drop very quickly. So a side effect can be excessive hypotension, where you become hypotensive. Your blood pressure drops way too fast, and then now you're hypotensive. You can have cyanide poisoning as well from it, just because of what the drug is made of. Something is like floating in the air. Um, and one of the things with this, it's only used short term because you can get the toxicity, like I just mentioned, the cyanide poisoning, if you use this for greater than 2 to 3 days. So short term only. This is not a drug you want to use a long time. Okay, the next one is going to be an enalapril, but you could also think lisinopril. Anything that ends in pril is an ACE inhibitor. So all my ACE inhibitor ends in pril. So that's just how I remember it. My prils are my ACE inhibitors. What are ACE inhibitors? What are they for? ACE inhibitors are for my heart. It's for my blood pressure. It's to bring down my blood pressure. So the ACE stands for angiotensin converting enzyme. So it's preventing this enzyme from being converted, and that's going to help prevent your body from reabsorbing water and sodium. And remember, when your body's taking back in more fluids, it's putting into your blood vessels, and that's going to raise your BP. So if I'm preventing it from taking in back that water, is going to cause my BP to go down, which is why it's an antihypertensive. So we use this in patients who have heart failure, because remember, when you have heart failure, your body is retaining a lot of fluids. We use it for hypertension. We can also use it for myocardial infarction, because you want to decrease that workload of the heart when someone has a heart attack. If you have a lot of fluids, it's not decreasing that workload. So you want to drop that workload, release that pressure, that fluid off of the heart. Um, some adverse effects with my prils is that first dose hypertension. A lot of times when you give it for the very first time, that patient's heart blood pressure can drop very low. and this is a common side effect. Like, think about it. If it's supposed to lower my blood pressure, if it works too well, it's going to cause me to become hypotensive. And that's something my professors always would tell us. When you're thinking about the side effects of medication, think about, what if this medication like does its job way too good? What's going to happen, right? So if a antihypertensive, a medication that's meant to lower my blood pressure, if it does it too well, I'm gonna become hypotensive. So any medication that's really for lowering my BP, a side effect of it can be my BP, my blood pressure goes too low. So think about that. Another side effect can be a persistent cough, very common, to the point that sometimes you have to switch off a person off of a pill, that ACE inhibitor, to a different medication for their blood pressure. They can have angioedema, which is that anaphylactic response, that allergy response. It can also cause fetal injury. So it is very harmful for pregnant women to take this medication. So if someone's pregnant, right? Like, if you were to see a question that really is, you could see is like, oh, a pregnant woman is taking these medication. Which one would you be most concerned about? If you saw an ACE inhibitor, any of these medication that ends in that PRIL, you would be concerned because it can be harmful to the fetus. So, yes. Next one. I did warfarin already. Oh, okay. Let's do this one because I actually really like this one. Prazosin. So the Zosins, right? These are selective vasodilators. They can be used for hypertension. With prazosin specifically, this is also used in PTSD patients for night terrors. This is the second time this thing has dropped. Like, I don't know why my suction thing is being so annoying tonight. Like, and I use this all the time. But you know what? Let's end it there because I'm getting annoyed. But yeah, if you guys like this, please let me know. I can make more. I can do more. But yeah, let me know what you guys think.